All right. So from the course title, you can see it is written basic and applied. So what does that mean, basic and applied? So the basic is you are going to be learning about the starting from the cell. In anatomy, we start from a cell. Once we are done talking about a cell, we are going to go to a tissue. Once we are done talking about a tissue, we go to now organs and then talk about systems. Okay, that's the basic part. There's also the applied part, meaning that if you learn the anatomy, you learn about a structure. You're supposed to understand how can you apply that in medicine. Let's say, for example, I say in today's class, say for example, talk about the anatomical terms. How is that important in medicine? It's so important because wherever that you go in this world, the language of anatomy is the same. So, for example, if someone's supposed to have surgery, right, and you say, okay, this person is supposed to have surgery of the leg, that is so unclear. What do you mean of the leg? Because someone will end up going to cut the right leg when you meant the left. And besides just saying leg, you should be so specific which side of the leg. Okay, so that's the importance. So there is the applied part. And this is human anatomy and development. So meaning you only don't discuss the anatomy, which is the structures, but you also discuss how do things start. So that's how we'll discuss this course, how everything started, all right? How did we start and how did we go by? But so to just understand the details of everything that we are saying, let's jump into this class. All right. So please feel free to stop me at any point if you are not okay, if you don't understand the concept. Please feel free to stop me. All right. So anatomy, the introduction. The word anatomy comes from the word anatom, which has got two parts, ana and tom. Ana is to mean upon. Please, we're not talking about Anna, that one, your best friend, all right? That Anna, your best friend, you put double N and then H at the end. So don't say upon or on, calling your friend like that. I don't. And then tom means to cut. So basically, anatomy means to cut upon. Okay, cut upon. And that's basically the way we study anatomy. You study anatomy by cutting. You need to deal with the real structures. So you need to deal with real structures. Anatomy is a branch of biology and medicine that is going to study structures. Basically, with anatomy, it is a structure. Physiology is the function of that structure. For example, in anatomy, we are going to say, okay, what are the parts or the structures that make up the heart? In physiology, we'll now answer the question, how does the heart work? Two different questions. But of course, in anatomy, besides you knowing the structure, they'll also ask you about how it works. But now it's different because in physiology, you to know the details of function. Okay, the details of function. For example, I'm going to tell you the stomach is going to be helping in digestion. But now the question is, how does digestion happen? How does the stomach produce hydrochloric acid to help in digestion? How do the small intestines help in absorption of nutrients? To go into the details, it's physiology. In anatomy, we'll just end at looking at the parts which will be helping in digestion. All right? So that is that. Physiology will go a bit in detail. Now, anatomy, physiology, and biochemistry, these three components are the basic medical sciences, and they are studied together for you to be able to understand medicine. All right. So you really enjoy medicine, especially as you get to go along and you becoming on the ward. Some of us stand out when we are on the ward because we know our anatomy, our physiology, and our biochemistry. So if someone doesn't understand these three courses, they'll be struggling a lot on the word. Of course, you have got other courses which are very important, like immunology, psychology, that will help you in interacting with patients. Now, anatomy should be regarded as a firm foundation for the whole art of medicine. Notice that medicine is actually an art. What does art mean? You learn it. You are not born with the knowledge. Just like leadership is not something you are born with, it is an art. You practice, you learn, you get to develop yourself every time. That is the same way with your relationship that is always breaking, forming, breaking, forming. You are not just naturally good, isn't it? About a relationship, you get to make it work. Okay, it is an art. So that this statement telling us that anatomy is actually an art and the essential preliminary for medicine was mentioned by Andreas Vesalius. So this is an anatomist who published a book which is known as De Human Corporis Fabrica Libri Septem in 1543. And he's the one who told us that anatomy is actually the very basic. Andreas Vesalius, De Human Corporis Fabrica Libri Septem in 1543. Okay, now anatomy is divided into three components. You have got gross anatomy, histology, and embryology. So, gross anatomy is where you study things that you see with the naked eyes. Okay, basically, you studying the macroscopic. Macroscopy means without a microscope. It's big, you can see with the naked eyes. So, you are studying basically the topograph. Topograph means the appearance. Okay, so that is that. You study structures, anatomical structures that can be seen by the naked eyes. For example, you can see what you can see on the screen here. They are studying there. And then histology, histo means tissue. For example, cells that you find in tissue, we call them histiocytes. You also have what we call osteo. Osteo means bone. So the cells that you find in bone, we call them osteocytes. All right. We have got also, so you can see the way we are naming them depending on the structure that you are mentioning. But you understand details as we get to dive deep in anatomy. You understand that the language of anatomy is constant and it actually makes things easier when it comes to naming. So histology is us basically studying microscopic structures, those that we can pick up with our naked eyes, except we study on the microscope. Now, basically what we study here are tissues. We have got the body is very, very big. But we only have four types of tissues for the entire body. The first tissue that we have is called epithelial tissue. And what we'll do actually, when we start discussing histology, the first topic we'll talk about is epithelial tissue. The next topic we'll talk about is connective tissue, and then muscle tissue, and then nervous tissue, in that order. After we discuss the tissues, and then we go to the organs. All right. So, of all the how complex the human body is, it is only divided into these four tissues. So every part of the body that you think of, just know that it falls in one of these tissues. For example, the skin is epithelium. Okay, the skin is epithelium, and then we have got muscles like skeletal, smooth muscle, and cardiac muscles. And then we have got the nervous system, which is made up of nerves. And then we have got connective tissue. Connective tissue basically holds every part together. So the way the body is made up is that we are going to have cells, and cells coming together will form a tissue. Group of tissues coming together will form an organ. Group of organs coming together will form a system, and group of systems coming together will form an organism. Now, the way we study histology is that we are going to get an organism, we cut a part of it. For example, if someone has got breast cancer, what we do is that we are going to cut a portion from their body. All right, sorry for that. The network just became slow. Hope you can be able to follow me. Just confirm that we are going together. All right, kindly confirm. All right, excellent. So the way we do, let's say for example, someone has got breast cancer, right? What we do is that that's the organism. The person is organism. So what we'll do is that we are going to cut a portion of their breast. We'll take the breast is the organ. And then from that breast, which is the organ, we'll just get a portion, which is a tissue. And then we'll study that tissue on the microscope to see the cells. All right, so that is that. And for you to study what I've just mentioned, we have got stages of preparing a tissue, and that's the next topic in histology. Okay, that's the next topic that we are going to learn in anatomy. It's known as histological techniques. So these steps that you can see that I put here with this instrument, you understand it when we discuss the first topic in histology. Now, embryology is also called developmental anatomy because we basically study how a human being is starting. So the way we discuss embryology is you first start to discuss how do sperms form, how do eggs form. Once you discuss that, we discuss the menstrual cycle of a lady. Okay, what happens in the menstrual cycle? When is the fertile period? All right, what makes someone to be infertile? Once we discuss that, and then we will We'll discuss what happens when the sperm and the egg meet during fertilization. Okay, what will happen in the first day of fertilization, after 6 hours, after 1 day, after 2 days, after 3 days, after 6 days, and then we start going in weeks. After 1 week, what is going to happen? 2 weeks, 3 weeks. When we are done with weeks, we start moving in months. What happens in the first month, second month? When we are done that until we reach the ninth month. And in the embryology, we also discuss after someone is born, what can go wrong? Why is it that some people are born the way they are born? Others are born like this. What can go wrong? So that is embryology. So what can go wrong when you are studying embryology? We call that part as teratology. So teratology, these are birth defects. What can go wrong during development? And then those are the components of human anatomy. Now remember, this class is the introduction to gross anatomy, all right? Not histology, not embryology. So in gross anatomy, the question is, how can we study gross anatomy? The things that you can see with your naked eyes. As we said, anatomy just means to cut. And medically, to cut means to dissect. So you people will actually be going to what we call the dissection room, DR. You actually be cutting human bodies. We call them cadavers. So we don't say the body, we call it a cadaver. It is a person that lived and then they passed on, but we are using their body to study anatomy. So for you guys, you'll be cutting yourselves. Okay, you'll be cutting yourselves. So it will be an interesting way of learning. So dissection of cadavers is very, very vital when it comes to learning anatomy. Now, the way we can learn anatomy is we can also, besides you dissecting cadavers, you can use also prosected cadavers, plastinated cadavers, plastic models, and 3D images. For what I've just mentioned, for example, dissection is cutting. What used to happen in the past is that they'll, at least for now, say someone is in surgery, to stop the pain, they'll give you what we call anesthesia. But that never wasn't, the anesthesia wasn't there. They'll just give you balls. You get drunk, they cut on you. So it used to be really painful. All right. So to dissect is to cut a cadaver. Dissecting specifically is going to refer to a cadaver, what is not living. But we also have what we call autopsy or postmortem. This is basically cutting a dead body to find the cause of death. Dissection is cutting a cadaver in order to study. Autopsy or postmortem is cutting a dead body to find out what caused their death. And that's important in what we call forensic pathology, in finding out the cause of the death. They'll tell you, okay, they are finding out first what killed the person. Yes, they are doing autopsy or postmortem. So prosected cadavers, this is basically where you have got a dissected cadaver. Okay, like for example, this is the liver, the real human liver, but then it has been embalmed with formalin. So as you go to the dissection room, to preserve those bodies, actually what is used is formalin, and formalin can be so painful. Some of you, when immediately you enter the dissection room, your nose will be paining, your eyes are paining, because it's a strong something. So most of the people prefer using a face mask, but as you get to go on, you forget about even putting on a mask. If possible, you can even go with a filter, but of course they don't allow food. But you just get used with time as you go on. Initially you might be a bit insecure, but you get over it. Plasmated cadavers is basically where you preserve a tissue with fluids using synthetic materials. All right, like for example, there are things they call silicone resins or epoxy polymers, where you are now preserving a tissue. Okay. And then you can also use plastic models, and these are the ones that you used to use in high school. These are plastic models to study the parts. Now, the way you approach anatomy or study anatomy is you can use two ways. You can use the regional approach or the systemic approach. Regional means that as you are studying gross anatomy, you go part by part. For example, at UNZA, we study using the regional approach. Like, for example, when you start learning anatomy, going to the DRL, you first start with the upper limb. Okay, you first start, they'll show you the actual bones, the scapula, the clavicle, the humerus. After you are done, you now go to the muscles, okay, of the upper limb, the muscles that make up your arm, your forearm, and your hand. And then after you are done with the upper limb, you go to the thoracic, which is your chest. You start from the outside. You look at the muscles outside the skin. You start going inside. You look at the rib cage, okay, the ribs, and then you go inside. You look at the heart, the lungs, and then you continue. You go down. You go to the abdomen. You look at all the parts in the abdomen. So for all these regions, you'll be looking at the muscles. You'll be looking at the nerves. You'll be looking at the structures there. You'll be looking at the blood vessels. You'll be looking at all the parts in these regions, the lymph nodes and such. That's how you study it regionally. And you go to the perineum or the pelvis, and then you go to the lower limb. Once you do the lower limb, then you are done with anatomy. That will be the final exam. You don't do the head at second year. The head and the neck, you do that in third year. At second year, you start from the upper limb, the thoracic, the abdomen, the pelvis, and then the lower limb. The systemic approach is where now you are studying the body system by system. But system by system is not good because, let's say, for example, you want to study the central nervous system. Or let's say you want to study the cardiovascular system. Cardiovascular is made up of the heart and blood vessel, meaning that you are going to follow one blood vessel. And what happens is that one blood vessel will move from the heart all the way to the legs, meaning that you are going to cut the entire body from the head to the legs. And that will mean that next time you want to study using that body, it's already destroyed because you cut the entire part. That is why the regional approach is important, because when you are in a certain region, you study all the system in that region, so that the other region is not affected. Next time you want to study the other region, all the other parts of that region are intact, you can study them also. Okay, so that's the one that we study. So for the systems, let's mention some systems that we know. Anyone to mention for me any system of the human body that you know? Any system? I'll start for you. The cardiovascular system. Yes. Anyone else? Any system of the human body that we know? The respiratory system. Excellent. The respiratory system. Very good. So we've mentioned two. Any other system? Any other? There are a lot, guys. There are a lot. Feel free. This is how you enjoy my classes. If especially if you can talk, I'm telling you, you are going to be a very big star in anatomy, which of course many people fear to say it's a killer course. Okay, very good, Wadia. The lymphatic and Rebecca, excellent. The reproductive system and the endocrine system, excellent. Okay, so we've mentioned cardiovascular, respiratory, lymphatic, endocrine, and then which other one has been mentioned? Reproductive. So five. Any other system? The nervous system, very good. The nervous system, that's six. Any other? The digestive, very good, Nasilele. All right. The digestive system, that makes seven. Any other system? Mm-hmm. Okay, why are you sitting right now? Why is it that you are not falling down? Why are you sitting? What do you think is making you to sit upright? Mm? Why is it that we can't bend your body anyhow? What do you have? The skeletal system, very good, Rebecca. Yes, yes. Okay. And then we also have what? For you to breathe, you have got the diaphragm. What is that thing called? Or maybe for you to show your biceps to your girlfriend. Hey, I love your what? Your 10 packs, your stomach. Yeah. What are you showing? If they say, I love people with a six pack. What are they talking about? What is in a six pack? Uh huh. Muscles, guys, muscles. So the muscular system. Now, most of the times, the muscular system and the skeletal system, we combine it to call it the musculoskeletal system. All right. So I already mentioned how we study using the regions. You start with the head and neck is at third year. You have got the trunk. Now the trunk is basically what supports every other part. The trunk is made out of the thoracic, which is the chest, the abdomen, the pelvis. This is where you find things like the bladder, the perineum. The perineum is, I'm going to show you, okay? The perineum. And then the back. And then the extremities or the limbs of the lower limb and upper limb. Systemic approach is where you now study the systems, the nervous system, skeletal, muscular, GIT, or the gastrointestinal, respiratory, endocrine, integumentary. Integumentary is basically the system that is made up of the skin and the appendages, things like the hair follicles, the nails. Okay, that's integumentary. The urinary system, cardiovascular, lymphatic, and reproductive. Those are the systems. Now, I have introduced you to the components of anatomy and how you can study anatomy. Now we are going into the anatomy, the language of anatomy. So before we can talk about the language of anatomy, is there any question so far of what we've discussed? Any question? Any question? Okay, very good. I believe we are okay, right? So now we are discussing how do we what's the language of anatomy? So with the first thing we need to discuss is the positions, just like I hear people mentioning these things about positions during intercourse, things that they like that. So anatomy has got also a position. There are different positions in anatomy, and the standard position in anatomy that we use to refer to such that even when you go to America, you go where they'll tell that okay, this is what you're referring to is what we call the anatomical position. So the anatomical position is actually the standard or the reference position for you to describe the body. So this is what we call the anatomical position. You can see the way this bro is standing. So look at the different parts. I want you to pay particular attention. You can see that starting from the head, this guy is looking forward straight. You are not looking down, you are not looking up, as though you are looking at something that is very, very far from you. You are looking at something that is distant. Okay? The inferior margin of the orbit is the eye. The eye, all right, that socket where the eye is going to be found. So the inferior part, the down part of where the eye is going to be at the level with the top of the external auditory meatus, the opening of the ear, If you remove the pinna, which is this outside thing that you can see, the opening of the ear, the top part. So that straight line like that. And if you can see, look at the hands. Okay, please. And this is anatomy. This part on top here, where there is the biceps, we call that as the arm. And then this part going down from the elbow up to the wrist, we call this as the forearm. And then this part which you use to touch in shima, that's called the hand. Please use anatomy. All right, use anatomy. Don't say no, your hand. You guys, you are doing anatomy. Forget. Don't say your hand again. Now you know which one is the hand. All right. And then when you go down from the hip up to the knee, we call this as the thigh. And then from the knee up to the ankle, we call this as the leg. From the ankle up to the toes, we call that as the foot. Okay? So again, please let's use anatomy since we're anatomy people, isn't it? All right? Hey, your foot is looking like a fufu veve. All right. So please just make sure you understand anatomy and use anatomy since you're anatomy people. Okay, so the anatomical position, there are features. Number one, someone is standing upright. Number two, the feet are together. The hands are by the side. And then the face is looking forward. The mouth is closed. The facial expression is neutral. You're not smiling, you're not upset. The rim of the bone under the eye is in the same horizontal plane as the top of the opening of the external ear. I already mentioned that. The eyes are open and focus on something in the distance. The palm is the part of the hand that used to touch or to hold in shima. So the palms are facing forward with the fingers straight and together, and with the pad of the thumb turned 90 degrees to the pad of the fingers. This one, this is the thumb, and then we've got the other digits. So from the thumb to this other digit, it should make 90 degrees. Okay, should make 90 degrees, not the way this bro is here. And then the toes are pointing forward. So this is what we call the anatomical position. Please know the description of the anatomical position. Besides the anatomical position, we have got other positions. Another position we have is known as a supine position. Supine means that you are facing upwards. Just think of your spine. Your spine is basically at the back. So think of your spine at the back, or down, your spine down. So that is supine. You are facing upwards. And not the way this girl is, all right? The palms, they should be facing upwards. But you can see for this one, the palms are facing downwards. So for the, it's basically the same way anatomical position is, but then you are lying down. And then we have got what we call the prone position. Prone is where now you are looking down. Okay, face down, the chest and abdomen also is down like that. And then we have got the lithotomy position. Lithotomy position is the position that you are going to be in. And this position is mostly used in what we call a component of anatomy known as obstetrics and gynecology. Let's say a woman is pregnant and we want to find out some things about, let's say, if the cervix is dilated. Some of you, I know you might be feeling shy. You are tambirating me. You don't do that in medicine. You, oh, if you come, just say vora. Okay, that's how they do it. Can vora. You remove the clothes and then put on gloves. We do everything that we want to do. The thing is that it's not romantic. We want to help. It's medical. Okay. Okay. Sorry for that. You know, sometimes the network is just behaving a bit like that, so don't be worrying. In case it goes a bit off, don't worry, it is coming back. All right. Hope you can follow me. Are we following so far? Are we following so far? Okay. So the lithotomy position is the one that is very good if you want to view. I put a picture specifically in this location so that you don't see things, because at this point you might be feeling shy, but you realize later on there's nothing to be shy about here. Okay, I can assure you there's totally nothing to be shy about. Actually, when you come on the ward, when you reach in fourth year, women are just lying down, you know, especially in these level one hospitals when they are delivering. Others are just even lying down, the others are, you know, so you are seeing everything that you can see everywhere. So medicine and being shy doesn't go together, all right, because you'll be able to see these things. So the way this woman is like this, if you look from this side, you look straight, okay, in that part, whatsoever that you are going to see there is known as the perineum. All right. Now, we also have what we call the planes, the body planes. Body planes are basically lines, and they're imaginary lines that you can draw on the body. And the importance of you drawing these lines, and remember I've said imaginary, is that they are going to help you in uh, giving the location of structures on the human body. The first line that we have is known as a coronal or frontal plane. Coronal is a line that will divide the body into front and back. So this line is like passing on the middle, okay, straight on the middle, and then it's dividing you. You have got the front here and the back. That's known as what? The coronal plane or the frontal plane. Okay. So when you use the, okay, we'll talk about that later. And then we have got what we call the sagittal plane. Sagittal plane is the line that you draw on the very middle. That is going to, it's an imaginary line through the middle that divides the body into lefty and right. Lefty and right. That is the sagittal plane. Please, I've said the sagittal plane is an imaginary line, but the specific line that is passing through the middle part of the body, that is known as the mid sagittal plane. The sagittal plane is an imaginary line through the middle part of the body, dividing the body into left and right. But a specific line passing on the middle part of the body, that's known as the mid sagittal plane. And then we have got also what we call the parasagittal plane. So when you get a line that you can draw on the very middle of the body, You just move it on any side, either to the left or to the right. That forms the parasagittal plane. For example, you can see the one that is appearing in red here is the mid sagittal plane because it's on the very middle of the body. And then the one that is in yellow is also dividing the body into left and right, but it's not on the middle. So that is known as the parasagittal plane. Para or parallel to the sagittal. So that's known as parasagittal. And then we have got also what is known as the transverse plane, also known as horizontal plane or axial plane. This one divides the body into up and down. That's the transverse or horizontal or axial. Up and down. So far, do we understand the different planes that we can use to divide the body? Is that clear? Does that make sense? Very good. All right. Okay. Now, Now that we know the terms to describe, to divide the body, we have got anatomical terms to describe the location. How do you know the location of this body part to this body part? So the first term is the anterior and posterior. The other term for anterior is ventral. The other term for posterior is dorsal. So anterior just means in front, or ventral just means in front, posterior or dorsal means at the back. So we use ventral and dorsal when we are using what we call the coronal plane. Remember I said that the coronal plane divides the body into front and back. Okay? So any part that is in front is anterior. Any part that is at the back is posterior or dorsal. For example, we can say the nose. When you're comparing the nose and the ears, we'll say the nose is anterior to the ears. Okay? Because the nose in front is in front. So don't say the nose is anterior from the ears. The nose is anterior to the ears. Or you can say the ears are dorsal to the nose because they are the back in comparison to the nose. Does that make sense on the anterior and posterior or dorsal and ventral? Does that make sense? Very good. All right. Please feel free to ask in case you are not okay. And then we have got medial and lateral. We use medial and lateral when you are comparing through the median plane. Remember the median plane, the plane that passes through the middle is the sagittal plane, also known as the median plane or the mid-sagittal plane. So any structure that is near the middle of the body, we call it medial. Any structure that is away from the middle of the body, we call it lateral. For example, we can say when you look at the nose and the ears, or the eyes. The nose is very much near the middle. So we say the nose is medial to the eyes. Or let's say we compare the breast and the belly button. The belly button is this kind of thing, akamutoto. Aye. So the belly button is medial to the breast. Or we say the breast is lateral to the belly button. Or let's say we are comparing the breast and the arm. So we say the arm is lateral to the breast. Does that make sense on lateral and medial? Do we get the sense? If you are getting the sense, your screen has got where to react, just press there. I know that you are following, all right? Very good. Okay. And then we have got superior and inferior. Now, superior and inferior, we use the transverse plane or the horizontal plane. Any structure that is on top, we call that as superior. Any structure that is down, we call that as inferior. Now, other terms that we use for superior, we also use cranial. Cranial just means head, so towards the cranium or towards the head. And then caudal means towards the tail, okay, meaning downwards. For example, we can say if you're comparing the head and the shoulders, the head is superior to the shoulders. Or if we are comparing, let's say, the knee joint and the hip joint, the hip is on top, the knee is down. So we'll say the knee joint is inferior to the hip joint. Or we can say the nose is cranial to the mouth, right? The nose is cranial to the mouth. So that means on top. Does the cranial and caudal or superior and inferior make sense? Okay, very good. The next term is proximal and distal. We use proximal and distal to refer to those parts that have got a beginning or an origin. Origin is the beginning, especially when you're talking about limbs. What do we mean by limbs? Limbs are basically from the hand, the forearm, and the arm, and also the foot, the leg, and the thigh. Basically, structures that have a beginning and the end. We can also refer to, we can use proximal and distal for things like nerves, blood vessels, because they have got a beginning and the end. Or maybe the respiratory system, it has got a beginning and the end. Okay, let's say for example, when you are looking at the upper limb, the beginning, in this case, the shoulder will be the beginning. So meaning that any part that is near the shoulder is going to be proximal. Proximal means near. Any part that is far away from the shoulder is going to be distal. If you talk about the lower limb, any part that is near the hip joint is proximal. What is very far away is distal. For example, we can say, uh, when you are comparing the hand, remember I said that the hand is this part used for touching, and then the elbow is on top. So we can say the hand is distal to the elbow joint because the elbow is on top. Or we can say we have got this joint here, the shoulder joint. The shoulder joint is also known as glenohumeral. You understand why it's named like that as we discuss gross anatomy. Okay. So glenohumeral joint is proximal to the elbow. The elbow is here, the shoulder is there. So the shoulder joint is proximal to the elbow joint. Okay, so that is how we use proximal and distal. Does it make sense on proximal and distal? Are we okay? Very good. And then we have got rostro. Rostro just means when you're using rostro, you are particularly referring to structures to do with the head. Okay, so we still use also the word cordo here. Cordo, remember we said down or towards the tail, but basically when you're referring to the head, rostro means towards the nose. So structures that are in front, we can also refer to that as ventral. Okay, rostro means towards the nose, and then cordo means away or posteriorly. Okay. And then we have got superior and deep. Now, for superior and deep, these ones we refer to them when we're talking about structures in reference, okay, from the surface going inside. So, any part of the body that is inside, we call them deep. Those that are on the surface, we call them superficial. For example, the intestines are deep to the skin because the skin is superficial. Or we can say the skin is superficial to the intestines. Does that make sense? On superficial and deep? Is that okay? Very good. And then we have got unilateral and bilateral. Uni just means same side. So when you're talking about structures that are on the same side of the board, we call them unilateral. And then those structures that are on both sides of the board, we call them bilateral. Okay. Now, please, unilateral means an organ that is only found, okay, on one side of the body alone. For example, the heart is only found on one side, and the heart is mostly on the left side. The spleen is mostly found on only one side and mostly on the left. The appendix is only found on one side and mostly is on the right, except in a condition which is known as uh, vitus inversus, sinus inversus, where the parts of the body gets to shift, or dextrocardia, where the heart instead of being on the left, it goes to the other side. Okay, so that in that case they can turn. But unilateral refers to those structures or organs that are only found on one side of the body. Situs inversus is where the structures turn and then they're on the other side instead of where you expect to find them. Bilateral are those structures that are found on both sides of the body. For example, the kidneys. The kidneys are found on both the left and the right. The lungs are found on both the left and the right. Also things like the testes, okay, the ovaries, they're found on both sides of the body. So those are bilateral. And then we have got ipsilateral and contralateral. Ipsilateral means found on the same part of the body. Let's say, for example, if it's on the left side, they are found on the same side. For example, the left leg and the left hand, those are found on the same side of the body. So we say they are ipsilateral. Contralateral means structures that are found on opposite side of the body. For example, the left leg and the right leg, those are on the opposite side. So they are contralateral. Does that make sense? Do we get the sense there? Contralateral and ipsilateral. Is that okay? Okay. Sorry, Doc. Can you say that again? Okay, yeah. So when you're referring to contralateral, it's basically anything as long as you can refer to anything as long as it's both on the left and also, I mean, anything that you can refer to as long as you're comparing what is on one side of the body and also on the other side of the body. Let's say, for example, if I'm talking about my right hand, right? I'm going to say my right hand is contralateral to my left hand, is meaning on the opposite side. Or I can say my left leg is ipsilateral to my left arm. Or I can say my heart is ipsilateral to the spleen, meaning that they are on the same side. Or I can say my heart is contralateral to the appendix, meaning that it's on the opposite side. That's the meaning of contralateral. It's on the opposite side. All right. Do we get now the sense now there? Is that proper now? Very good. And then we have got what we call invagination and evagination. So this will refer to body parts. You have got some body parts that go inside. Inside, just think of invagination, it means to go inside. And then evagination means to go out or to project. And then when you are referring to the hand, you have got specific terms here. When you look at the hand, the part of the hand that you use for touching, we call that as a palm. And then the opposite part, we call that as a dorsum. Same way with the foot, the part that you use to step, it is similar to the palm, but we call that as a plantar. And then the top part is the dorsum still. So the dorsum doesn't change. What only changes is the plantar and the palm. The palm is the part that you use to touch on your hand. The plantar is the part you use for walking on your foot. While the dorsum will refer to the other parts altogether. So the thing is that for the plantar and the palm, when you discuss the skin, these two parts of the body, they actually have got a different skin from the rest of the body. They have got what we call thick skin. The skin, specifically what we call, because the skin is made up of two layers, the epidermis and the dermis. The epidermis has got 5 layers: stratum corneum, stratum lucidum, stratum spinosum, and then we have got stratum. There is one that I've left out. Okay, spinosum. So, stratum corneum, stratum lucidum, we have got the spinosum, and then we have got the basal. There's the fifth layer that I've left out and it has gone. But when you look at the layers of the skin, the 5 layers of the epidermis, there is one layer that is only found on the palm and the plantar. We call that, that's why we call this as thick skin. Okay, so that is that. So let's say if you can combine terms, we are done with the learning. So now exam questions. The- I'm giving examples. For example, the chin is in. We can actually combine. Okay. Look at this. The nose is medial to the ears, isn't it? The nose is medial to the ears. At the same time, the nose in front of the ears. So it is the nose is anterior or ventral to the ears. So we can actually compare, since we know that the nose is medial to the ears and the nose is anterior to the ears, we can combine and make one statement. So we'll just say the nose is anteromedial to the ears. I can give you another example. Okay, let's say we're talking about the mouth, okay, the mouth and which one can I refer to? Okay, let's say I'm talking about the penis and the breast. So the penis is inferior to the breast At the same time, the penis is medial to the breast. So it is inferior to the breast and medial to the breast. So I can say the penis is inferior medial to the breast. Or if I was comparing, let's say, the hand, okay, the hand and which part? Okay, let me get another one. Let's say I'm comparing the mouth and the shoulder. So the shoulder is lateral to the mouth. At the same time, the shoulder is going to be, which one is more anterior? Okay, the mouth is more anterior. So the shoulder is a bit more posterior. So the shoulder is posterior to the mouth. So the shoulder is the lateral to the mouth. The shoulder is posterior to the mouth. So I can say the shoulder is posterolateral to the mouth. So you can combine these terms. Okay, you can combine them. That's why you can see here. I've said the shoulder joint is superolateral to the belly button. The meaning of that is that the shoulder is actually on top of the belly button. At the same time, the shoulder is lateral to the belly button. Do we get the sense when it comes to combining the terms? Does that make sense? Very, very good. Okay, excellent. So there are also terms that we use to describe movement. Okay, movement. For example, we have got what we call flexion and extension. To flex means to bend or to reduce the angle. For example, if I'm talking about the elbow, okay, if I move my forearm towards my body, okay, I'm bending the angle, we call that as flexion. If I'm straightening it, we call that as extension. Same way with the wrist, this is the wrist joint here. If I'm bending the angle, okay, if I'm going downwards, that's flexion. And then if I'm going upwards, that's known as extension. If I'm talking about, let's say, the trunk, the entire trunk, if I'm pushing myself forward like that, that's known as flexion. I'm bending. If I'm pushing myself backwards, I'm straightening. That's extension. Now, specifically for the foot, it has got special terms. Remember, we said that for the foot, the top part of the foot is the dorsum, the down part of the foot is the plantar. The plantar, that one used for stepping. So when you are moving the foot downwards towards the plantar surface, we call that as plantar flexion. If you are moving the foot upwards, we call that as dorsiflexion. So for the foot, we don't say extension. There's no extension. We just use either dorsiflexion or plantar flexion. Does that make sense? Are we okay? I'm not seeing people reacting. Does that mean that I've confused you? Have I confused you? No? Okay. And then we have got what we call lateral flexion. Remember, to flex is to bend, but if you are bending on the side, that's known as lateral flexion. And then we have got adduction and abduction. Adduction, think of ADD, that's to add. So adduction is adding. So when you're talking about the foot, you have got this big toe, we call it as the policies, okay, the policies. So when you are moving these tomatoes n- towards the second toe, that's known as adduction. If you are moving them away from the second toe, that's known as the abduction. Abduct is to go away. Same way with the hand. The reference point is the middle. Please, for the foot, the reference point is the second toe. For the hand, the reference point is the middle finger. If you are moving towards the middle finger, okay, moving towards the middle finger, that's adduction. Away from the middle finger, that's abduction. And then if you come now to the entire upper limb, if you are bringing the entire upper limb near the body, That's known as the adduction. Away from the body, that is abduction. Same way with the entire of the lower limb. If you're moving it towards the body or the middle, that's known as adduction. Away from the middle, abduction. Does that make sense? Do we get the sense there? Very good. All right. And then we have got what we call circumduction. Circumduction is basically moving in a circle. Okay. Like for example, if you the way we used to do when we are children, when you want to throw a stone very far, you start moving your hand, all right, around, and then you throw it. So that is the circumduction. Circumduction. Okay. So circumduction is basically movements and they're in a specific order. You can start with flexion, you first bend, and then you abduct, you extend, and then adduct. Okay, flexion, abduction, extension, adduction. You can start from any direction. You can also start from extension. You go to, in other words, you can start from any point and go in any direction, as long as you are following this order. Let's say, for example, I can start from extension, and then I go to abduction, and then to flexion, and then I go to adduction. It's a circle, right? It's a circle. I can start from adduction, I'll go to flexion, abduction, extension. So in that order. So you can so mostly start from flexion and then end with adduction, or start from extension and then you go like that. So you are moving in a circle like that. Okay, so it's basically moving in a circle. That is circumduction. And then there's what we call medial rotation or internal rotation and the lateral rotation or external rotation. So medial rotation is you getting to rotate, moving towards the middle. For example, you can see this one on this middle picture. If I'm moving the hand and the forearm towards the body, rotating it like that, that's known as medial rotation. If I'm moving it away from the body, that's lateral rotation. That's same way with the trunk. If I'm standing straight and then I'm trying like facing away from the midline, that's lateral rotation. That's rotation. Same way with the foot. If I'm moving like the foot, okay, or the leg outwards, okay, like you can see this camera drawing that is not so clear, that's moving outwards, that's known as lateral rotation. If you're moving it medially or towards the midline, that's known as medial rotation. And then we have got supination and pronation. To supinate, supination just means, remember the way I mentioned the supine position is when you are facing upwards. That's supination, when you are facing the palm of your hand upwards. And then pronation, remember the okay, that one is a different term, but pronation is to face, like when you are beating a basketball. Okay, you are beating it down. That's pronation. So one thing that you need to know is that when your hand is in a pronated position, you have got these two bones, the radius and the ulna. The bone that is near the thumb is known as the radius. Okay, that's why we call this part as the radial aspect. So during pronation, what happens that the radial bone is going to go on top of the ulnar bone. That's what happens during pronation. Okay, but don't worry much about that. But that's a question that they can ask in the exam during pronation. There's also what we call opposition and reposition. To oppose means that any of your fingers are being pushed. Okay, you are bringing them towards the thumb. That is opposition. And then if you are moving them away now, that is reposition. So opposition, reposition. Opposition is when you are bringing any other finger towards the thumb. When you move them away, that is reposition. Are we okay so far? Are we okay? Very good. And then we have got inversion and evasion. So inversion means you okay, like if you are standing, right? If you are standing up and then you are trying to make sure that the down your the plantar surface of your foot is facing the middle of the body, the midline. Okay, that's inversion. Like you are stepping on this side where there's a kamalitu the kamalitu what? This kamalitu toe down here. If you are stepping your foot like on the side where there's a camalitu to such that your plantar surface is facing the middle of the body. We call that as inversion. And then if you're stepping downwards using the side where there is the big toe, we call that as eversion. Inversion, eversion. All right. And then we have got protraction and retraction. Protract. Okay, like for example, these dudes, let me tell you guys, you ladies, a secret for these guys. They don't have even a chest. But once they see you, they push the camera chest out. I think that's also the ladies how they do. We know you don't have breasts, but once you just see me because you like the assiduous boy, you even come and stretch out your camera chest so that I can see as though you have the breast. After all, after all, your camera chest is just flat. It is very flat. Yeah, so you push your chest out like that. That is known as the retraction. So to retract basically means to pull outwards the scapula. Okay, the scapula is going outwards, but then the chest is coming inwards. That is retraction. To retract is to pull back. So your scapula, the bone that forms the that holds the upper limb, is going behind. To protract, protraction is now you pushing the scapula forward, and that's similar to to retraction like that. Okay, uh, retrusion and protrusion. Retrusion again is basically you pushing. Okay, retrude like to remove, to push your parts outwards. For example, you can say uh, to protrude. You when you remove your tongue, you point out your tongue outward. That is to protrude. Can you? Okay, so this is what you should tell now your people back home, because you've learned another. Hey, young sister, can you try to protrude your tongue? I want to just see what is on your tongue. Can you protrude it? Okay, fine. I've seen it already. You can retract it so that they know that you've learned anatomy. Yeah, yeah. Can you retract yourself from my life? Okay. Can you retract, like remove yourself from my life? Retract yourself. I'm special. You know, they should feel you. They should feel the doctor in you. Yeah. So that is the anatomy there. All right. So to protrude is to basically pull back, or yeah, to protrude is to remove, to remove. What to retract or retrusion is to take back. All right. And then you have got elevate and depress. To elevate is to push upwards. For example, you can elevate your shoulders. To depress is to push downwards. Okay. So that is where this topic one finishes. What I have now is a quiz, and this is how all our classes go by. Every time we do it, it's now a quiz. But I'm not doing this quiz after this class. We are doing it now, and it will be you answering. You'll be opening your microphone, you answer, or you can just type in the chat box. Okay, this is from the final exam. Actually, this one was these questions were, yeah, from the final exam, final exam. All right, the one I wrote when I was at your level. The first question is saying the anatomist who published the famous and influential book titled The Human Corporus Fabrica Libricepte is A. Aristotle, B. Hippocrates, of course, C. Andreas Visarius, D. Claudius Galen. Any answers? Any answers? Okay, Nasilele says C. Anyone with a different thought? Okay, very good, very good. So the answer is C. The next question is the book in question one above was published in which year? 1443, 1543, 1643, 1743. How about that one? Okay, David says it's B, Evelyn says it's B. Please feel free to open your microphones. Feel free. Okay, excellent. Okay, thank you very much. So we are all very correct. The next question says the reference position of the body is called supine, prone, anatomical position, homeostasis, standing. What is the answer there? Okay, Vualia says C, Evelyn types C. Namatai, what did you say? Okay, very good. You guys are so geniuses. Great. All right. Very good. Next question. In the foot, the term adduction implies movement of the toes towards the dash. In the foot, the term adduction implies movement of the toes towards the dash. A, first toe. B, second toe. C, third toe. D, fifth toe. E, fourth toe. Evelyn says B. What do others say? Walia also says B. Okay. Anyone else? Excellent. You guys are geniuses. The next term. What does the positional term proximal mean? A, near the surface of the body. B, toward the body trunk. C, close to the center. D, away from the midline. E, toward the tail. What do we say? What does the term proximal mean? Is it near the body, the surface of the body, towards the body trunk, close to the center, away from the midline, or towards the tail? What does proximal mean? Uh-huh. It seems like it's a tricky question. Mm-hmm. What do we say? Okay, Nematai says near the surface of the body. What do others says? What do others say? Uh-huh. So when okay, Jacob says B, what do others say? Okay, very good. So the answer here is B. Let's just help our friends that could have missed it. So near the surface of the body, that one is superficial. All right, superficial and deep is near the surface. But any body part that is near the trunk or near the beginning, remember the trunk, basically the chest, the abdomen, this part where the upper limb and the lower limb connect. Any part that is near the trunk is called proximal. All right. And then close to the center, that is medial, away from the midline, that is lateral, towards the tail, that is caudal, isn't it? All right. Which of the following anatomical terms mean on different side of the body? A, sagittal. B, ipsilateral. C, contralateral. D, lateral. E, deep. Different sides of the body. Which one are we going to pick? Okay. Walia says C. Nasilele also says C. Any other thought? Okay, Evelyn also says C. Very good. You guys are geniuses. Which of the following planes specifically divide the body into unequal right and left parts? Unequal right and left parts. A, sagittal. B, parasagittal. C, mid-sagittal. D, coronal. E, lambdoid. What are we going to pick? Evelyn says B. Anyone else? Okay, Namatai also says B. Anyone else? Okay, so far what has been mentioned is correct. You guys, you are geniuses. All right, excellent. Which of the following structures is superior to the rib cage? Okay, in other words, on top of the rib cage is these ribs that are hiding your heart, your lungs, right? Yeah, that's the rib cage. So which one of these structures is on top? Superior, right? The feet, the knees, the hips, the neck. What are you going to pick? Okay, very good. Namatai and Evelyn says B D. All right. Excellent. Truth, that is correct. Nasilele, that's correct. Walia, that's correct. Very good. Okay. Which of the following structures is superficial to the tooth? Superficial to the tooth. Lips, larynx. The larynx is inside. This thing where air will be passing, okay? The tongue, the trachea. So which one do you think is superficial to the tooth of what has been mentioned? Evelyn says A. Okay, very good. You guys, I love you people. I love you. Yeah, excellent. The lips. Okay, the lips are superficial because the tooth are inside. Your sternum is dashed to your vertebral column. Your sternum, the sternum is this bone that is just in front. When you touch your middle, okay, the middle of your rib cage, that's your sternum, is dashed to your vertebral column. Your vertebral bones are the bones at the back. A, inferior. Your sternum is dashed to your vertebral column. Inferior, superior, posterior, anterior. What are we gonna pick? Namatai says D. Any other? Evelyn also says D. Any other? Okay. That is very correct, guys. That's correct. The sternum is anterior to the vertebral column. Which of the following correctly describes the two named body parts? A. The elbow is proximal to the shoulder. B. The phalanges are these stomach bones. When you come to the hand, right? To your hand. Those stomach bones at the end of the hand. Those are what we call the phalanges. So the phalanges are distal to the carpals. The carpal bones are on your wrist. The wrist is where you turn, where you can bend your hand in case you want to say, you know the way girls do when they're saying that their to my hand are also turning, going downwards. I hope you can imagine what I'm doing now. My hand is also moving down, right? Balemfwa bwino balemeka feel, yeah. Yeah, so the point where you turn your hand, that's the wrist. That's where you have your carpal bones, and then the phalanges are at the end. So option B is saying the phalanges are distal to the carpals. C is saying the ribs are proximal to the sternum. D is saying the elbow is distal to the knee. Which one do you think we are going to pick in this case? Any thought? What are we gonna pick? Okay, Evelyn says B. Anyone else? Okay, Evelyn is actually correct. The phalanges are distant to the carpals because the phalanges are the end. The carpals are much near. Okay, any stretch that is near from the start, which is where the elbow joint, where of course near the midline, sorry, near the trunk, that means it's proximal. Complete the sentence correctly. Cervical vertebrae are the cervical vertebrae. Okay, these are vertebral bones. Now, you answer that one later as you understand the bones. Which of the following statements rightly describe a plane? It is a solid line that is drawn on the body of a subject. It is the cut surface of the body. The coronal and the mid-sagittal sections are examples. An imaginary flat surface dividing the body. What do you think? Which statement correctly describes a plane? Excellent. Okay, very good. D. Now, C could have been correct, the coronal and mid, but the mid sagittal is a specific term to refer to the line that passes through the mid. Maybe if we say the sagittal, not the mid sagittal. All right. Which of the following terms best describe the movement of the great toe towards the rest of the toes? The great toe towards the rest of the toes. Protraction, pronation, adduction, retraction. What do you think on this one? Movement of the great toe towards the rest. Evelyn says C. What do others say? That's actually correct. Yeah, when you move structures towards each other, that is adduction. That's correct. What does the term inversion mean? Dorsiflexion of the foot, Turning of the foot to make the surface medially, plantar flexion of the foot, turning of foot to make its surface laterally. Which one describes inversion? Any thought on that one? Any thought? Remember, I was even describing like you standing on the side where there's like a small toe. Okay, that's inversion. Is to make sure that the down part of your leg, of your foot, which is the plantar surface, is facing medially. That is the inversion. If it is facing laterally, that is evasion. The directional term superior in anatomy means which of the following? A. Cephalic, B. Ventral, C. Caudal, D. Dorsal. What does the term superior in anatomy mean? Anyone? Okay. Remember, ventral means in front, so it can be superior. Caudal means towards the tail, so it can be superior. It actually means inferior. Dorsal means at the back, so cephalic means superior. Cephalic means towards the head. Okay, towards the head. The anatomical position could be described as which of the following? A. Lying down prone. B. Lying down supine. C. Standing displaying the ventral surface of the body. D. Standing with arms and legs adducted. Which one do you think is correct? So remember, in anatomical position, you stand while you are displaying the front part of your body. You don't abduct, okay, your legs. The legs should be straight. They should be near. So you actually abduct the legs. So the answer is C. Okay. So the last question. Oh, we've done this one. We've done that. Okay. We've done that. We've done that. Okay. So this is basically it on the introduction to anatomy and the language and ways of studying anatomy.